A very good day to everyone. I'm Chang Yu.
I am Chang Ling.
And I'm Dr. Foong.
Today, we are going to share something about the conceptualizing how diaphragmatic singing may improve the pulmonary health of people with long COVID symptoms. So humans always facing various challenges, including several types of viral infection diseases that becoming a threat to human survival. For nearly 2 decades, people have been exposed to 3 highly pathogenic and deadly human coronavirus, which includes the SARS, MERS, and the COVID-19. These coronavirus get more attention from people because of their ability to cross animal-human barriers and emerge to become a major human pathogens. These are a brief summary of 3 coronavirus, which include the first emergence date, location, and some data on the number of infected cases and attributed death. The COVID-19 patients will be facing various symptoms with different levels from mild to critical. The most common symptoms included fever, cough, tiredness, and loss of taste or smells. Besides, when the symptoms become more serious, it might cause sore throat, headache, itches and pains, diarrhea, a rash on skin, discoloration of fingers or toes, and red or irritated eyes. Apart from that, the critical symptoms included difficulty breathing or shortness of breath, loss of speech or mobility, or confusion and chest pain. So plenty of research found that even though the COVID-19 patients who recovered from the COVID-19 infection but still face some feelings of illness, no matter physically or mentally caused by the COVID-19 infection, is always known as the post-COVID-19 condition or long COVID. This is some current. There is some current evidence suggesting that above 10% to 20% of the recovered COVID-19 patient face different conditions of mid or long-term effects after they recovered from the initial illness. So many research found that the post-COVID-19 condition affected a variety of human body systems, included the general health such as the persistent fatigue, breathlessness, loss of sense of smell, brain fog. While in the part of respiratory system included the chest distress, chest pain, cough, breathlessness, and some lung function abnormalities. Besides, there are also some symptoms reported in the cardiovascular and hematological system, neurological system and mental health, and otorhinolaryngological system and endocrinological system. Let's go to the problem statement. So nowadays, although people have some clues on the long COVID-19 symptoms, the specific treatment or rehabilitation for the post-COVID-19 condition still has not yet to exist or discovered. The actual reason or the mechanism regarding the development of the disease COVID-19 needed to be understood first, then the specific treatment could be designed. Unfortunately, the inadequate of the rehabilitation may affect the quality of life in various areas for the recovered COVID-19 patients, especially who with long COVID-19 symptoms. Although there was some research done regarding the long COVID-19 symptoms, there is a depth of evidence-based research on the condition of vocal health and pulmonary health of the people who recovered but with long COVID-19 symptoms. Since the voice, singing, and pulmonary system are related, singing and breathing will be the most important elements in this research, including use it as a research tool or taking consideration to suggest a music-based rehabilitation. From the past research, it showed that singing may be able to achieve improvements on breathing capacity, muscle tensions and posture, and reduction of respiratory symptoms. This proved again the mechanism of singing is always related to the usage of the lung or respiratory system. Let's go to the objective. The first one will be to identify theories which are related to the formation of the music-based rehabilitation framework for the people with long COVID-19 symptoms. The second one will be to design a music-based rehabilitation framework for the people who with long COVID-19 symptoms. Literature review. So regarding the human communication function, it belongs to part of the roles of respiratory system. The respiratory systems helps in communication in various ways. Next, humans always depends on the respiratory system when they are singing. For example, the contraction of the diaphragm will be involved in singing to control the muscles for inhaling and exhaling. Many research discovered that the breathing control that is applied to the professional singing training is kind of similar to what they used in controlled breathing instruction for the people who with COPD and asthma. Besides, one of the studies discovered that the diaphragmatic breathing training for the people with COPD for 4 weeks demonstrated improvements in breathlessness and the quality of life. In order to develop a rehabilitation framework that might help the recovery of the long COVID-19 symptoms, the mechanism of the respiratory system and pulmonary system must be taken into a serious consideration. The general mechanism of the respiratory system will be the transfer of oxygen and carbon dioxide. Generally, the main role of the respiratory system is to deliver oxygen to the cells and tissues of the body to allow the metabolic demands of the cells and tissues to survive with the minimum amount of energy expended from lungs. After the delivery of oxygen, naturally, the carbon dioxide will be brought along as the byproduct of the cellular metabolism in the human respiratory system and go back to the lungs. The whole procedure of delivering the oxygen and transferring the carbon dioxide will begin from the uppermost airway, which is the nares, and end in the alveoli in the lungs. Once again, the human communication function is belong to the parts of the roles of the respiration system. For instance, the lower airway structure in the chest wall of the respiratory system, such as the diaphragm, abdomen, rib cage, and other of the respiratory contents encased in this structure supports the human communication function. The chest wall controls a suitable level of muscular pressure, and this will assist in achieving the communication goal. The chest wall also prevents the typical relaxation of pressure observed during the normal breathing to control the subglottic pressure for a specific phonatory task. Consequently, the action of the chest wall are always dependent on lung volume. For instance, the high lung volume at the onset of the phonation requires increased muscular checking action of the chest wall to maintain the appropriate pressure for speech and vice versa. Similarly, human always depends on the respiratory system or mechanism mentioned when they are singing. For example, the contraction of the diaphragm will be involved in singing to control the muscles for inhaling and exhaling. Therefore, singing always depends on the respiratory system and the pulmonary system. I will pass to Ling now.
There are limited research on singing rehabilitations for long COVID-19 patients up to date. A pioneer program, ENO Breathe, was introduced by English National Opera, partner with NHS UK during the pandemic. The objective of ENO free online breathing course is to assess the effectiveness of interventions of singing with active diaphragmatic breathing supervised by trained opera singers. It was a program across 6 weeks with long COVID patients enrolled with persistent dyspnea in which they have received training on breathing techniques and basic singing skills during the course of the interventions. Data was collected before, during, and after the interventions in focus group. The outcome is reported to be positive, supportive the suggested research hypothesis, and 82% of the participants in the singing interventions reported improvements to the symptom of dyspnea. Next, from the review of Curic article, it is known that the effectiveness of the pulmonary rehabilitations while engaging singing with active diaphragmatic breathing could not be directly measured. However, from several articles' reviews, we can draw a hypothesis that lungs health is related for vocal range and vocal amplitude. A more directional hypothesis can be drawn as such. The experimental group have improved pulmonary health with larger vocal range and vocal amplitudes after the interventions of diaphragmatic breathing and singing exercises. From the singing interventions, the vocal exercises design focus on the relaxed posture and active engagement of diaphragmatic muscles. Study has proven that the diaphragm is functioning as maintaining the stability of the core as well as the ventilation muscle. A well-trained classical singer can acquire wider vocal range and vocal amplitude, and this phenomenon responds to the hypothesis of wider vocal range and larger amplitudes is the result of systematic training to the diaphragmatic breathing control via singing. However, related to quantitative analysis that shown that effectiveness of prescribed protocol of diaphragmatic singing exercises has more impact on professional classical singers than the amateur singers. The ability to control the diaphragm thorax movements during the inhalations and exhalations increase the pressure in the abdominal cavity and hence lengthen the exhalation in a steady control while singing and contribute to a better vocal quality. Now, concerning the lungs health in relative to singing, a phrase that next page we will know as the chi sa respirare sa cantare in the next slide, a phrase that reflects the accuracy of bel canto voice singing as translated into ones who breathe well, sings well. Most vocal pedagogues understand that the efficiency of breathing affects the quality of voice, hence the limitations of the range and amplitude is closely related. Compromised respiratory system due to COVID-19 potentially compensate on the two dependent variables above. Coffey et al. Found that the common sequelae of long COVID-19 symptoms are as following: fatigue, dyspnea, and complaint about vocal fatigues and reduced phonations functions. After COVID-19 infections, patients' lungs potential has reduced function during scarring of the lungs and affected the pressures of the lungs. It is considered that the lungs pressure are associated with COVID-19 induced acute respiratory distress syndrome, and the applications of positive and expiratory pressure, PEP, is commonly as one of the non-invasive treatments. The ultimate aim is to increase the stress applied to the lungs, and the total stress is the sum of the transpulmonary pressure generated by the patients and by the end expiratory airway pressure. Though in singing rehabilitations, we do not go through the interventions of medical equipment. However, that draws the conclusions of pressure of the lungs is related with pulmonary health index, and hence we suggest that singing rehabilitations is plausible. Next, we have a pictures diagram of showing lungs health is related with pressure. And in the next slide, we have the equations that display to you, and the PL is the maximum transpulmonary pressure, defined as the total stress applied to the lungs. And for a simplified understanding for everyone, to the pressure in the lungs can affect the mechanism of singing, we can refer to Pascal principle by using the formula P equals to pressure, F equals to force, and A equals to area. Consider that under the same circumstances, the force required to apply for a scarring lungs as compared to normal lungs is higher. Hence, the singing interventions is targeted to train the participants on applying appropriate singing technique in control of the diaphragm muscles to achieve a similar effect to the healthier lungs. Consequently, it will contribute to an improved breathing technique that reflects to the vocal amplitude and range. In the next page, we have a table that shows you our theoretical framework, which is the LRP, laryngeal respiratory physiology. And in the next slide, I will explain what is the theory of LRP showing us. Next. So the theory of respiratory physiology, in the next page, we will show that this is the mechanism of the respiratory resistance with airflow and breathing time. Greater respiratory effort or greater force is required to apply with a reduced surface of area for the injured alveoli. The developed conceptual protocol for us for the long COVID singing rehabilitations, all known as the COSIA, incorporates the understanding of Pascal principle and the relationship of pressure and force to the training of diaphragmatic breathing techniques for the singing targets to control the thoracic pressure. However, there are no specific singing rehabilitations framework being established for long COVID up to date. Conceptual framework that is related can be taken as reference is music-based voice intervention protocol, the MUSVIP, that is designed for Parkinson's disease. Before the interventions, the participants are required to fill in 2 questionnaires as baseline data, which is the VHI and the VRQOL. There are 5 aspects in dependence variable to be investigated in MUSVIP, which are vocal amplitude, pitch range, respiratory change, quality of life, and overall effect through the 8 consecutive weeks of singing interventions. The weekly 2 hours are spent on vocal warm-ups and basic vocal techniques is to build a mechanism of breathing habits and short singings with rhythmic movements. The activities are eventually target the dependent variable through vocal coaching sessions with the professional singers. But clinical works on music therapy for speech and language disorder are much common, that we can see that it involves the similar coordinations of respiratory, phonations, and articulations of the text. Similar to the MUSVIP, the NMT is a research on the vocal amplitudes as dependent variable and sustainable phonations. The protocol framework includes a principal concept, which is known as OMREX, which functions to strengthen the tongue, lips, cheeks muscle for phonations enhancement. Todd also explored the possibility of using wind instruments. Hence, if applying the same concept on singing, a longer vowel sounds were assumable to be made after singing interventions. Good breathing control can reflect on the applicable of stable pressure and sustainable phrase, as well as good breathing can reflect of applying effective force on phonations and make louder productions of voice. Hence, increased ability of control to the respiratory muscle will eventually help the long COVID symptom. In 1930, Schmidt developed a voice therapy technique known as the accent method, of which the protocol focused on respiratory, phonatory, articulatory exercise to culture a new habit for singing and for the effectiveness of abdominal breathing. The role of respiratory in phonations is from the coordinations between the larynx and the lungs. Voice disorder can be associated with MTD and PVFMD, and both of these can be caused by acid reflux or viral infections, which remind us about COVID-19. The common symptoms are vocal breathlessness, hoarseness, and strain. Therefore, the patients require stronger respiratory effort to increase the phonations airflow to maintain the subglottic pressure for phonations. And sufficient low lungs volume are usually reported with patients with breathlessness issues than the normal reports. Therefore, a long COVID patients who suffer from low respiratory infections may affect the phonations due to low muscular force in the thoracic cavity. Singing interventions that target to address respiratory management will eventually help discussed as the AEM. Next, this is the conceptual framework to the COSIA based on the MUSVIP and AM. The sound pressure level is measured by decibel with sound level meter, and the pitch range can be measured from voice 2, and the breathlessness and strains can be measured from opera vox. I will pass my time to Dr. Ang.
In conclusion, the voice-produced system and the respiratory system is related. Thus, the activity of singing may provide a certain effect on pulmonary health. Similarly, the voice quality will also affected by the respiratory system or pulmonary system relatively. Thus, this presentation concludes all of the above and conceptualize how singing may have an effect on pulmonary and vocal rehabilitation for people with long COVID symptoms.
Thank you for listening.